All right, everybody, this is Dr. Nelson. He wants to talk to some symptoms and how we can get better from chronic illness.
There's a lot of chronic infections out there regular doctors do not recognize, nor do they understand, nor does the standard lab work find it. But before I go there, a lot of you people are buying all this stuff on the internet, or your doctor said this is good and this is good and this is good. The companies we use only go through FDA inspections. And if you call the company or ask the doctor if it goes through FDA inspections, now FDA and GMP is completely different. GMP, they can do it in-house. FDA is outside. FDA inspectors come in to inspect. Not because they're doing anything wrong, but make sure they're doing anything right. And it's free of chemicals, metals, insecticide, pesticide, all that kind of stuff. So you need to be really, really careful what you're buying. We only use FDA assayed certified supplements. That's all we use. Secondly, a lot of people that are having chronic health problems, and this is something we can discover either by testing you remotely or in person, is hidden emotions. If you have hate of someone and you've never resolved the problem, or fear, or resentment, you need to go to a practitioner who's going to help you get rid of it. Because the more emotional the problem gets, the sicker you get. I think that's why a lot of people are taking a lot of antidepressants, because very few doctors but me understand the root cause of illness, and it's a big one, okay? It's a huge one. So I'm going to talk a little bit about what we call hidden mold, and comes from a lot of places. So, first place it comes from is the mouth. Damage to root canals. Root canals are dangerous. Aerobic and anaerobic bacteria. If you're getting a lot of these problems, somebody needs to really examine your mouth to find out if it's coming from there. I talked a little bit about vitamins. Synthetic vitamins are not absorbed. You can actually find it in the colon and backing up the liver. I talked about we don't use things that do that. We've actually seen it on x-ray. A mold patient had chest pains, 46-year-old female. We gave them the right enzyme for chest pains, decreased inflammation from the mold. It was coming from the GI tract, and a month later all of his pain went away. Get rid of brain fog. We have various, I will call them essential oil supplements that will help you get rid of brain fog. Patients build up lipid factor inflammations that affects the heart, etc. We look at the C-reactive protein, lipids, and fibrinogen. Folks, if you look at me this afternoon, I'm tired, I haven't shaved. I apologize about that, but I got too many projects going on.
A lot of clients.
Mold toxins affect the heart, and they do. And mold and Lyme and all these things are co-infections, and they do affect the heart. Toxic homes are bad. There's a group called a book called Mold Warriors. It's a book. Go get it. It's called, another one's called Mold Issues, Thriving and Surviving. That's another book. Mold is also associated with co-infections, bacteria, yeast, virus, parasites. Must treat them. Mold exacerbates everything else that's wrong with you. Everything.
Yes.
There's a basic mold panel. I'm not going to talk about that. That one's not that expensive. And then we also would like to draw blood for EBV, heavy metals, especially looking for mercury. And there's a lot of mercury problems.
I had that. Dr. Nelson detoxed that mercury. I could feel it leaving my tooth. And that was from him doing that.
Mycotoxins released from mold spores, aflatoxin, and the worst toxin of all is guanin, Guenin. Really, really nasty. Causes anxiety, depression, poor memory, mood swings, and then of course you've heard about sick building syndrome. And it's in schools, it's in offices. Symptoms: itchy eyes, sore throat, coughing, breathing trouble, palpitations, nausea, major anxiety, learning issues. You can look up on a website called vcs.com, and it's going to give you information about toxic exposures. You also got a test for volatile organic toxins, which is called the VOT test. Test toxins from plants, solvents, perfumes, and cologne. Here's a case of a non-Hodgkin's lymphoma patient. They had what they called a positive MTHFR gene, brain fog, etc. Mold can produce rashes. It can produce a lot of things. And it's very much akin to candidiasis. We're not going to go into that today. 50% of U.S. buildings from water damage are moldy.
That's what happened to me.
48% of the people that are exposed to mold get symptoms. That's a lot. It's half.
Yeah, it's a lot.
There you can run another test called the Hilda test, and test for the HLA gene. Mold looks fuzzy. 100,000 different types of species, including Stachybotrys, Penicillium, Fusarium, aspergillosis, and a nasty one called Getomimium. I'm just sort of floating through here because there's a lot of pages. Mold spores, histamine from mast cells. Let's see what else I want to talk about.
Well, he also knows how to get down the mast cell. I had extreme mast cell. I could not even eat onions, and he figured out a way to get it down safely without taking these artificial supplements for histamine. And I was feeling a lot better after that.
Yeah, you got to break up the histamine.
Yeah.
Let's see, where am I at here? Mold spores, I talked about that. Biotoxins from bites. SIRS, biotoxins from mycotoxins. There's a GPS for toxins in urine. GPS checks urine. A lot of people have chest symptoms, anxiety, I talked about that. Bloodshot eyes is another one for mold.
I had that too. I had itchy eyes too.
Symptoms: fatigue, weakness, light sensitivities, poor memory, poor thoughts, cannot form words, joint pain, shortness of breath, and static shock. If you're walking around and getting shocked a lot, even on a normal carpet or like a floor like this, 2 reasons: mold or heavy metals. Heavy metals either come prior exposure like well water or something like that, or fillings. Remember I said a lot of this starts in the mouth.
That's what happened to me too. Tattoos.
Tattoos. And I really think at this point, I'm going to leave it at that, and then we'll continue on with this. We just wanted to give you kind of a short snippet, and as I told you, I'm not real efficient today because of the length of the week, but the whole idea is to get information to you so you can start forming some executive decisions for yourself. I've treated over 6,000 patients, both the United States and Europe, and yes, we do it remotely. I know how to do that. I studied at Baden-Baden in Germany, and they're the best in the world. So you can always call for a free consultation. I do not have Nick's number here, but if you call me or text me, I will forward it to him so he can explain it to you. So my number is 702-610-3081, 702-610-3081. Now, did you know I'm in 3 of Suzanne Summers' books? Let me hold up one at a time. This one's called Breakthrough. I have a chapter in this book. Get the book, read it. It's very good. My material and everybody else's. I was the editor for this book called Knockout by Suzanne Summers, another one. And this book I was editor of called Toxic, how sick we're getting from toxins. So get these books, read them. Now they're not expensive. And give you a good background in the way we think and the way we approach